Have you ever felt a sudden pain in your chest and instantly thought, is this a heart attack? Your heart starts racing, your breathing becomes shallow, and fear takes over your mind. Many people, especially seniors, have experienced this exact moment. But here's something that might surprise you. Sometimes that terrifying chest pain is not coming from your heart at all. Sometimes it's coming from your stomach. Yes, gas and digestive problems can create chest pain so intense that it feels exactly like a heart attack. And the most shocking part is that thousands of people rush to emergency rooms every year thinking their heart is failing, only to discover that the real culprit is trapped gas or gastric irritation. Now, this doesn't mean chest pain should ever be ignored. Your heart is one of the most vital organs in your body, and real heart problems are very serious. But understanding how gastric issues can mimic heart attack symptoms can save you a lot of fear, confusion, and unnecessary panic. Today we're going to talk about why gas pain can travel to your chest, why it can feel so frightening, and how seniors in particular need to recognize the difference. Imagine this scenario. You just finished a meal. Maybe it was a little heavier than usual. Maybe it included fried food, spicy food, or something that tends to cause bloating. A little while later, you begin to feel pressure in your chest. It's not just mild discomfort, it's a tight, squeezing sensation. The pain might move upward toward your throat or spread toward your shoulder. Suddenly you're wondering if something is terribly wrong with your heart. This situation happens far more often than most people realize. Inside your body, your digestive system and your chest area share many nerve pathways. Your stomach sits just below the diaphragm, which is the muscle that separates your chest cavity from your abdomen. When gas builds up in your stomach or intestines, it can create pressure that pushes upward toward the diaphragm. This pressure can irritate nearby nerves that also communicate with your chest area. When those nerves send signals to your brain interprets the pain as chest pain. This is why gastric discomfort can feel so similar to heart pain. The nerves involved are closely connected, and your brain cannot always tell the difference between the source of the signal. For seniors, the situation becomes even more confusing. As we age, digestion slows down. The muscles that move food through the digestive tract become less active, which means food stays in the stomach longer. This delay can increase gas production and bloating. Many seniors also take medications that affect digestion, causing additional gas or acid buildup. Because of these changes, chest discomfort from gastric problems becomes more common with age. Another reason this confusion happens is acid reflux. Acid reflux occurs when stomach acid flows back up into the esophagus. The esophagus runs through the chest and connects the throat to the stomach. When acid irritates this area, it can create a burning or squeezing pain right in the center of the chest. Many people describe this pain as identical to heart pain. If you've ever experienced severe heartburn, you know how alarming it can feel. The burning sensation can rise up toward the throat, sometimes even reaching the jaw. Some people feel pressure that spreads toward the back or shoulders. It's easy to see why someone might believe they're having a heart attack. Another common cause of gas-related chest pain is trapped gas in the upper abdomen. When gas becomes trapped, it can expand and push against surrounding organs. This pressure can travel upward into the chest cavity. The pain may feel sharp, stabbing, or tight. Sometimes it comes and goes suddenly. Other times it lingers as a dull ache that makes you feel uncomfortable and anxious. Certain foods are known to increase gas production. Beans, carbonated drinks, fried foods, cabbage, onions, and highly processed meals can all create extra gas in the digestive system. Eating too quickly can also cause you to swallow air, which leads to additional gas buildup. Now think about how many people eat meals while distracted. Watching television, scrolling on a phone, or rushing through dinner can cause you to eat much faster than your body prefers. When food is swallowed quickly, more air enters the digestive system. That extra air can later become trapped gas that produces pressure and pain. Stress is another factor that plays a surprising role in digestive discomfort. When you feel stressed or anxious, your body releases hormones that slow down digestion. Food sits longer in the stomach, gas accumulates, and the chances of bloating increase. Stress can also cause you to swallow more air while breathing or talking, which contributes even further to gas buildup. Now here's something very important to understand. Even though gas pain can feel like a heart attack, you should never assume chest pain is harmless. If chest pain is severe, sudden, or accompanied by symptoms like shortness of breath, sweating, dizziness, or pain spreading into the arm or jaw, medical attention should always be taken seriously. Your health and safety always come first. However, there are certain clues that may suggest the pain is related to gas rather than the heart. For example, gas-related chest pain often changes when you move your body or shift positions. Sometimes sitting upright or walking around can help relieve the pressure. Burping or passing gas may also reduce the discomfort. Another clue is timing with meals. If the pain begins shortly after eating a large or heavy meal, it could be linked to digestion rather than the heart. Acid reflux and gas pain often appear within an hour or two after eating, especially if the meal was spicy, greasy, or very large. Some people also notice that the discomfort improves after taking antacids or digestive remedies. These medications reduce stomach acid or help gas move through the digestive system more easily. But again, these clues are not perfect guarantees. When in doubt, it is always better to seek medical advice. Let's talk about why seniors need to pay special attention to digestive health. As we age, several changes occur in the body that affect digestion. The stomach produces less digestive acid, which can slow the breakdown of food. The muscles that move food through the intestines may become less active, leading to slower digestion and more gas formation. Older adults are also more likely to have conditions such as acid reflux, gastritis, or hiatal hernia. A hiatal hernia occurs when part of the stomach pushes upward through the diaphragm into the chest area. This condition can increase acid reflux and chest discomfort after eating. Medications can also contribute to gastric symptoms. Many common prescriptions used by seniors, such as blood pressure medications, pain relievers, and certain antibiotics, can irritate the stomach or increase gas production. This combination of slower digestion, medication effects, and age-related changes means that gastric chest pain can become more frequent later in life. One helpful habit for reducing gas-related discomfort is eating smaller meals. Large meals place extra pressure on the stomach and increase the chance of acid reflux and bloating. Instead of 3 heavy meals per day, some people find relief by eating smaller portions spread throughout the day. Chewing food slowly is another simple but powerful habit. Digestion begins in the mouth. When food is thoroughly chewed, it becomes easier for the stomach to break it down. This reduces fermentation in the gut and decreases gas production. Staying upright after eating can also help prevent chest discomfort. Lying down immediately after a meal allows stomach acid to move upward into the esophagus more easily. Sitting or walking for at least 30 minutes after eating can support smoother digestion. Hydration is also important. Drinking enough water helps move food through the digestive tract and reduces constipation, which can contribute to gas buildup. Another helpful tip is identifying foods that trigger your symptoms. Every person's digestive system is unique. Some individuals are sensitive to dairy products, while others may react strongly to fried foods or carbonated beverages. Paying attention to what you eat and how your body responds can help you avoid triggers that cause discomfort. Physical activity plays an important role as well. Gentle daily movement, such as walking, helps stimulate the digestive system and encourages gas to move through the intestines more easily. Even a short walk after meals can make a noticeable difference in reducing bloating and pressure. Deep breathing can also provide relief. When you take slow, deep breaths, your diaphragm moves downward and upward rhythmically. This movement gently massages the digestive organs and can help release trapped gas. Many people underestimate how powerful simple lifestyle changes can be. By improving eating habits, reducing stress, and staying active, you can significantly lower the chances of experiencing gas-related chest discomfort. There is also a psychological aspect to this experience. When someone feels chest pain, fear immediately appears. The mind begins imagining worst-case scenarios. That fear can cause muscles in the chest and abdomen to tighten, which may actually worsen the sensation of pain. Understanding that digestive issues can create similar symptoms can help reduce unnecessary panic. Knowledge gives you the ability to stay calm and observe your symptoms more carefully. Another interesting fact is that gas pain can sometimes shift location. It might begin in the upper abdomen, move toward the chest, and even spread toward the back or shoulders. This shifting pattern is common with gas because the air pockets move through the digestive tract. Heart pain, on the other hand, often feels more constant and may come with additional symptoms such as extreme fatigue, nausea, cold sweating, or a feeling of heavy pressure in the chest. Still, the overlap between these sensations is why doctors often perform tests such as ECGs or blood tests when someone arrives at the hospital with chest pain. They want to rule out heart problems before concluding that the cause is digestive. For seniors, this awareness is especially valuable. Recognizing patterns in your body can help you respond more confidently when discomfort appears. Imagine being able to tell yourself, "I just ate a heavy meal and I'm feeling bloated. Let me sit upright, walk for a few minutes, and see if the pressure improves." Sometimes that simple awareness can prevent unnecessary anxiety. At the same time, respecting the seriousness of chest pain ensures that you never ignore something truly dangerous. Your body is constantly sending signals. Learning how to listen to those signals with calm attention is one of the most powerful tools for protecting your health. Many viewers watching right now have probably experienced gas pain at least once in their lives. Some of you may remember moments when the discomfort felt so intense that you genuinely feared a heart problem. If that has happened to you, you are not alone. Doctors see this situation every day. In fact, a significant number of emergency room visits for chest pain end up being related to digestive issues rather than heart disease. This doesn't mean the fear was unnecessary. Chest pain is always a symptom that deserves attention. But understanding the connection between digestion and chest discomfort can help you respond with more clarity instead of panic. Taking care of your digestive system is actually one of the best ways to protect your overall health. The gut influences many parts of the body, including energy levels, immunity, and even mood. Small daily habits, like mindful eating, gentle movement, and proper hydration, can make a huge difference in how your body feels. So the next time you feel that uncomfortable pressure after a meal, remember that your digestive system might simply be asking for a little more care and attention. Your body may just be reminding you to slow down, breathe, and treat your stomach with the same respect you give your heart. Now, one of the most important things every senior should understand is how to recognize warning signs that clearly separate a real heart attack from gastric chest pain. This knowledge can protect your life, but it can also prevent unnecessary panic when the discomfort is actually related to digestion. The challenge is that the human body does not always make the difference obvious. The chest area is filled with nerves that communicate with several organs, including the heart, stomach, esophagus, and even the diaphragm. Because of this shared network, pain signals can feel very similar, which is why many people struggle to tell the difference in the moment. One of the first warning signs that points more toward a heart problem is the feeling of deep, heavy pressure in the chest, rather than sharp or shifting pain. People often describe heart attack pain as a crushing weight sitting on the chest. It may feel like something extremely heavy is pressing down on the center of the chest and refusing to go away. This sensation is often steady and persistent. Gastric pain, on the other hand, is more likely to feel sharp, stabbing, or burning. It may come in waves and sometimes move around, depending on gas movement inside the digestive tract. Another major clue is how long the pain lasts and whether it improves with simple actions. Gas-related chest discomfort often changes when you move your body. If you stand up, stretch, burp, or walk around, the pressure may gradually decrease. Sometimes, even shifting positions can make a noticeable difference. Heart attack pain usually does not improve when you change positions or walk around. The discomfort tends to remain constant or slowly intensify, regardless of body movement. Paying attention to where the pain spreads can also offer important hints. Heart-related pain frequently radiates outward from the chest. It may travel into the left arm, the shoulder, the neck, the jaw, or the upper back. Some people even feel the discomfort spreading into both arms. This spreading pattern happens because the nerves connected to the heart share pathways with nerves in those areas of the body. Gastric chest pain usually stays closer to the upper abdomen and middle chest. It may move slightly upward toward the throat due to acid reflux, but it rarely spreads down the arm in the same classic pattern seen with heart problems. Another key difference involves breathing. During a heart attack, many people experience sudden shortness of breath. Even if they are sitting still, they may feel like they cannot take a full breath. This can happen because the heart is struggling to pump blood efficiently, which affects oxygen delivery throughout the body. Gas pain may create a feeling of fullness in the chest that makes breathing uncomfortable, but it usually does not create the same intense sense of air hunger that heart problems can cause. Sweating is another warning sign that should never be ignored. Heart attacks often trigger what doctors call cold sweating. This is not the normal sweat you might experience on a warm day or during physical activity. Instead, it appears suddenly and can make the skin feel clammy and cold. Many people describe feeling drenched in sweat even though they are not exerting themselves. Gastric pain rarely causes this kind of dramatic sweating response. Nausea and vomiting can appear in both situations, but the context often differs. With digestive issues, nausea typically follows a heavy meal, spicy food, or known triggers like acid reflux. The discomfort may be accompanied by bloating, burping, or a sour taste in the mouth. In a heart attack, nausea may appear suddenly without any obvious digestive cause. Some people feel an overwhelming wave of nausea, along with chest pressure and weakness. Fatigue is another important sign, especially in seniors. Before or during a heart attack, many individuals report feeling an unusual level of exhaustion. It can feel like the body is suddenly drained of energy. Simple activities like walking across a room may feel unusually difficult. This type of fatigue can appear hours or even days before the actual chest pain begins. Gastric chest pain usually does not produce this same deep sense of physical exhaustion. Another warning signal involves dizziness or lightheadedness. When the heart struggles to pump blood properly, the brain may receive less oxygen than it needs. This can cause dizziness, faintness, or even brief loss of consciousness. Gas-related discomfort may make someone feel uncomfortable or anxious, but it rarely causes true lightheadedness linked to reduced blood flow. The speed at which symptoms appear can also be different. Heart attack symptoms sometimes develop suddenly and intensify quickly. A person may feel fine one moment and then experience strong chest pressure within minutes. Gastric pain is more likely to build gradually after eating or during periods of bloating. Timing related to meals is another useful clue. If chest discomfort begins shortly after a large meal, especially one that is fatty or spicy, digestion is a possible cause. Acid reflux and gas buildup often occur within an hour or two after eating. Heart attack pain is less connected to meals and may appear during physical exertion, emotional stress, or even during rest without any link to food. However, it is important to understand that heart attacks do not always follow the classic pattern people expect. Seniors, women, and individuals with diabetes sometimes experience what doctors call silent or atypical heart attacks. In these cases, chest pain may be mild or even absent. Instead, the person may feel unusual fatigue, shortness of breath, nausea, or discomfort in the back or jaw. Because of this possibility, relying on a single symptom is never enough to rule out a heart problem. Looking at the overall pattern of symptoms provides a clearer picture. For example, imagine someone feels chest discomfort after eating a large meal. The pain feels sharp and comes with bloating. After walking around for a few minutes and burping, the pressure begins to fade. This pattern leans more toward digestive discomfort. Now imagine another scenario. A person suddenly feels intense pressure in the center of the chest while resting. The pressure spreads into the left arm and jaw. They begin sweating heavily and feel short of breath and dizzy. The discomfort does not improve when they change positions. This pattern strongly suggests a heart emergency. One helpful question to ask yourself during chest discomfort is whether the sensation changes when you press on the chest area with your hand. Gas pain and muscular pain sometimes become more noticeable when the area is pressed. Heart-related pain usually does not increase with direct pressure on the chest wall. Another clue is the presence of excessive belching. Gas-related chest pressure is often accompanied by repeated burping. As gas escapes from the digestive system, the discomfort may slowly decrease. Heart attack pain does not improve after belching. Acid reflux also has some distinct sensations. Many people feel a burning feeling rising from the stomach into the chest or throat. There may be a sour or bitter taste in the mouth. This is caused by stomach acid traveling upward into the esophagus. While uncomfortable, this type of pain is very different from the heavy pressure associated with heart attacks. Body posture can influence gastric pain as well. Lying flat after eating often makes acid reflux worse because stomach acid can move upward more easily. Sitting upright or walking around may reduce the burning sensation. Heart attack pain usually does not respond to posture changes. Another warning sign that should always be taken seriously is sudden weakness on one side of the body combined with chest discomfort. This could indicate problems with blood circulation that affect both the heart and the brain. The emotional feeling associated with the symptoms can also provide clues. During heart attacks, many people experience a powerful sense of impending danger. They may feel intense anxiety or a sudden fear that something is very wrong. While gastric pain can certainly cause worry, it usually does not produce the same overwhelming sense of doom. Age and medical history also play a role in evaluating chest pain. Seniors who have risk factors such as high blood pressure, high cholesterol, diabetes, smoking history, or previous heart disease should be especially cautious when chest discomfort appears. Family history matters as well. If close relatives have experienced heart attacks or heart disease, the risk may be higher. Another difference involves physical activity. Heart-related chest pain sometimes appears during exertion, such as climbing stairs, walking uphill, or carrying heavy objects. This happens because the heart needs more oxygen during activity. If the blood supply to the heart is reduced, pain can develop. Gas pain is less connected to physical exertion and more linked to digestion. Sometimes people notice that antacid medications provide relief. If chest discomfort improves after taking antacids, the cause may be related to acid reflux or stomach irritation. Heart attack pain does not respond to these medications. Monitoring the rhythm of the heartbeat can also offer hints. During heart problems, the heartbeat may feel irregular, very fast, or unusually strong. Gastric discomfort usually does not alter the heart rhythm directly, although anxiety about the pain may cause temporary heart racing. Another observation involves abdominal bloating. When the stomach becomes distended with gas, the upper abdomen may feel tight or swollen. Pressing lightly on the stomach may release trapped gas and reduce pressure. This type of bloating is not associated with heart attacks. For seniors, it can also be helpful to remember that digestive discomfort often follows patterns based on food choices. Carbonated drinks, fried foods, onions, beans, and certain dairy products can trigger gas production. If chest discomfort consistently appears after consuming these foods, digestion may be the source. Even so, repeated chest pain should always be evaluated by a healthcare professional. Frequent symptoms may indicate acid reflux disease, gastritis, or other digestive conditions that need treatment. Learning to recognize warning signs does not mean diagnosing yourself. Instead, it means becoming more aware of how your body communicates when something is wrong. Doctors often say that when it comes to chest pain, it is always safer to assume the heart could be involved until proven otherwise. Quick medical evaluation can rule out serious conditions and provide peace of mind. Hospitals use tests such as electrocardiograms, blood markers, and imaging to determine whether the heart has been affected. These tests can detect even small signs of heart muscle damage. If the heart is healthy, the focus then shifts toward identifying digestive causes like acid reflux, gas buildup, or inflammation of the stomach lining. Understanding these differences empowers seniors to respond more calmly when symptoms appear. Instead of immediately assuming the worst or completely ignoring the pain, they can observe the pattern, consider recent meals, and pay attention to accompanying symptoms. Being informed also helps family members support loved ones who may experience chest discomfort. Recognizing dangerous warning signs ensures that emergency care is sought quickly when needed. Listening carefully to the body is one of the most valuable skills for maintaining health later in life. Subtle signals often appear before major problems develop. By learning how heart attack symptoms differ from gastric chest pain, seniors gain a powerful layer of awareness that can guide better decisions during moments of uncertainty. Every heartbeat and every digestive movement inside the body is part of a complex system working constantly to keep you alive and functioning. Understanding the language of these signals allows you to respond wisely when the body asks for attention.